Treating severe acne vulgaris, specifically the deep papules, pustules, nodules, and cysts, remains one of the most stubborn challenges in clinical dermatology. This difficulty stems from the complex pathology of the disease. Acne vulgaris is driven by a precise sequence of events: sebaceous gland hyperactivity, follicular hyperkeratinization, bacterial proliferation, and deep dermal inflammation. Standard monotherapies frequently fail on severe cases because they omit one or two of these mechanisms. If the bacterial count drops but the hyperkeratinization remains unchecked, the disease continues to progress. The Remediast Acne Clarifying Face Serum was engineered to solve this overlap. It is a pharmacological delivery vehicle designed to dismantle all four pathogenic pillars simultaneously. The formulation relies on a precise matrix of active molecules: salicylic acid, zinc, Hemamyllis virginiana, or witch hazel, and hyaluronic acid. By mapping these specific agents directly to the pathogenesis tetrad, physicians can achieve high-efficacy intervention for inflammatory lesions, bypassing the severe adverse effect profiles associated with systemic isotretinoin or chronic oral antibiotics. The acne cascade begins with follicular hyperkeratinization. Dead skin cells fail to shed normally, binding with excess sebum to form a solid plug that traps oxygen out and seals bacteria in. To dismantle this physical barrier, the serum utilizes a beta-hydroxy acid, salicylic acid. Unlike alpha-hydroxy acids, which are water-soluble, salicylic acid is highly lipophilic. This oil solubility allows the molecule to bypass the skin's surface moisture and drive deep into the lipid-rich environment of the blocked follicular canal. Once inside, it targets the intercellular cement, specifically the desmosomes holding the dead corneocytes together, and breaks those bonds apart. This keratolytic action rapidly forces the desquamation of the trapped keratinocytes, physically dissolving the comedone and unclogging the pore. However, removing the physical plug is only the first step. The biological drivers of the disease are still highly active in the deeper dermal tissue. With the anatomical pathway now cleared, the tissue requires immediate pharmacological suppression to halt the underlying immune response. Salicylic acid effectively prepares the battlefield. It opens the follicular canal so the formulation's deep tissue anti-inflammatory agents can actually reach their targets. This brings us to the severe end of the acne spectrum: the deep, painful papules, nodules, and cysts. These severe lesions result from a localized hyperactive immune response, a cytokine storm occurring deep within the tissue. The presence of Cutipobacterium acnes inside the pore triggers toll-like receptors on the skin cells. This activates NF-κB, a critical transcription factor, which then migrates directly into the cell nucleus. This activation commands the massive release of pro-inflammatory cytokines, specifically interleukin-6 and interleukin-8. The formulation's primary countermeasure to this inflammatory cascade is Hemamyllis virginiana, commonly known as witch hazel bark extract. The clinical efficacy of this extract relies on its highest density active phytochemicals, polymeric proanthocyanidins. These proanthocyanidins physically impair the NF-κB activation pathway, forming a blockade that stops the transcription factor from reaching the nucleus. The clinical result is a near-total localized inhibition of IL-6 and IL-8 release, stopping the inflammatory escalation in its tracks. To ensure complete suppression, witch hazel is paired with zinc as a synergistic anti-inflammatory partner. Zinc executes a distinct but complementary mechanism. It binds to local macrophages, halting their production of TNF-alpha and nitric oxide. This dual-pronged suppression cuts off the primary inflammatory mediators from two distinct angles, rapidly pulling down the swelling, erythema, and physical pain of deep nodules. By utilizing this biochemical synergy, dermatologists can aggressively control cystic inflammation at the source, eliminating the need for systemic corticosteroids. Beyond inflammation, modern dermatology faces a looming crisis: the rapid rise of C. acnes antibiotic resistance, driven by decades of chronic oral and topical prescriptions. Treating the bacterial pillar of severe acne requires potent antimicrobial efficacy, but we must achieve it without relying on traditional antibiotic pathways. Instead of chemical antibiotics, the formula uses zinc and specific essential oil extracts to exert a direct physical bacteriostatic action against C. acnes. Because this intervention relies on an elemental disruption of the bacterial cell, It carries zero risk of generating antibiotic resistance over time. Zinc's utility also extends to a secondary capability, the direct modulation of localized sebaceous gland activity. Sebum production is heavily driven by hormones, specifically the conversion of testosterone into dihydrotestosterone, or DHT, by the 5-alpha reductase enzyme. Zinc physically blocks this enzyme's active site. By inhibiting this conversion, local DHT levels drop, which directly suppresses the glandular overproduction of sebum that bacteria rely on to multiply, simultaneously starving the bacteria of their sebum fuel source while physically halting their proliferation, completely removes the biological variables required for future breakouts. There is one critical flaw that causes patients to abandon high-efficacy acne therapies: aggressive treatment-induced epidermal compromise, characterized by severe dryness and peeling. Maintaining the structural integrity of the stratum corneum is a non-negotiable requirement for any long-term acne management protocol. To protect this barrier, the formulation employs hyaluronic acid as a precision-engineered countermeasure. Looking at the molecular structure, the repeating units of glucuronic acid and N-acetylglucosamine give this polymer its extreme water-binding capacity. Because the formula utilizes low molecular weight hyaluronic acid, the fragments easily penetrate past the surface layer and bind directly to CD44 receptors on human keratinocytes. This binding triggers the stabilization of the extracellular matrix, pulling in and trapping moisture to promote profound deep tissue hydration. Because this hydration is achieved on a molecular and cellular level, the hyaluronic acid is entirely non-comedogenic. It provides crucial moisture without reversing the keratolytic unclogging work of the salicylic acid. It acts as an architectural stabilizer. It ensures that the serum's aggressive keratolytic and anti-inflammatory actions clear the disease without destroying the skin's structural integrity, securing high patient compliance. When applied to a severely compromised pilosebaceous unit, these 4 distinct biological mechanisms execute a coordinated pharmacological strike. Salicylic acid rapidly dissolves the intercellular cement for deep follicular unclogging. Zinc and witch hazel systematically shut down cytokine and macrophage pathways, neutralizing deep inflammation and cystic nodules. And hyaluronic acid reinforces the epidermal barrier, maintaining hydration and treatment tolerance. By systematically addressing every stage of the acne pathogenesis cascade without introducing systemic side effects or fueling antibiotic resistance, the Remedist Acne Clarifying Face Serum stands as a scientifically rigorous, highly reliable first-line intervention for mild to severe acne.